Like Jonathan said, I've been a few places. I love the scope of veterinary medicine. I like ER, I like urgent care, I like GP, and I started off very conservative as far as I only wanted to practice what I was taught in vet school. That made sense to me. I was comfortable with that, and I felt like that was the gold standard. And then, as time goes on, I had my own pets and client pets that I could not help anymore because of limitations. There just weren't enough tools in my toolbox to address those, some really complicated cases. And a lot of them were my own pets, and my own pets will be in this presentation on Ozone even. So with that said, when I go to conferences, I usually am thinking about like whatever the topic is, diabetes or surgical conditions that we can address. Always somebody's animal pops into my head or one of my critters, and I think, oh, I could use that for this situation. So that's what I encourage you to think about with this presentation, these three in a row. We're going to start off with what is ozone and how does it work, and then go to some case studies that I've got for you, and lots of my own pets, and then finally how you can integrate it. So we're basically a GP practice, and what I'm talking about today would work in anybody's practice. You don't have to be a holistic veterinarian to use this, which is so cool. It's a pretty short learning curve actually, and technician driven. The veterinarian will figure out where it needs to be applied, but then the technicians are the hands-on. And it's really neat to see the changes, and I'll show you, like I said, in there. The other thing I want to tell you is I like this to be a little bit interactive, so that's why I'm going to be drawing also. So interactive for me, but also there are some books that I've got here that Jonathan has written about ozone therapy for animals. There's a bunch of them on the market for people, but not many that are like a practical guide on how to use it for pets and in medical situations. So he's not a veterinarian, but he's written with the expertise of veterinarians who are using this in the field, and there's a lot of great information and applications in here. I am going to be giving these away when people answer questions. So you can get a free copy. All right, let me start. The slides in green are the propriety of O3 Vets. So there's a copyright there that I want to, why do you not do that now? There we go. Just so that everybody knows this is a lot of material that he's put together, and then I've added some extra case studies, so it's copyrighted. And I'm dedicating this to my dog Chaz, who I lost 2 years ago to a high-grade sarcoma. He's sitting in Miranda's lap. That's one of our techs. She's one of the ozone gurus also. But he had a high-grade soft tissue sarcoma behind his left shoulder, behind his scapula, that I could not see until it popped its head up, and it was the size of a pork chop already on a CT scan. And the surgeon at MedVet said, just let him be a dog. And that's good advice, but I couldn't just let him go yet. So, and I know a lot of you guys are, I'm sure, in the same boat, right, with your own animals. So I had it genetically tested to see what chemo might work. I had that mass sent off to Torrigen to make an autologous vaccine, and gave him 3 rounds of vaccine. From that, it didn't work. The best results he had were on actually Chinese herbs, and mistletoe is a homeopathic that you can inject around tumors. People have been using it in Germany for years for cancer protocols, and if anybody's interested, I could tell you about that later. And then CBD for pain, and he did really well with that, but it kept coming back. So I am a open-minded skeptic, I guess I would say. So things, I have to see like a reason for using them before I will use them, and sometimes out of desperation. So that's when I reached out to O3 Vets because that was one modality I'd read about, but I had not actually had any personal experience with. And I bought an ozone generator. They supplied it to me on a Saturday, and I started his treatments immediately. He had 2 days of IV ozonated saline. He was doing great. I went home. He had, before I left for work, he went out, did his business. Everything was great. I came home that night, and he did not want to get off the couch. So I decided that was time to let him go. What I know now, this bottom thing, this bottom word, Herxheimer, is a reaction that you can see if the body is detoxing a tremendous amount, and it can cause fatigue. So I may have let him go too soon, but I'll never know. I know in my heart it was okay, but it's a cautionary tale. Sometimes you will get cases where they look a little wiped out afterwards. If you think about dogs after chemo, things like that, they're going to be a little bit lethargic sometimes. So anyway, cautionary tale. He came in to see me when he was 2 years old to be euthanized. And I could tell on the exam that he was probably hypothyroid and not just dying of terrible skin and had no energy. And thankfully his owners let me adopt him. So he got 9 extra years and he was such a great dog. He went with me everywhere when I did relief. A lot of you guys may have met him. Yeah.
Dr. Lucas, we don't have the audio going on here, so if you can speak up, make sure to talk loudly.
Oh, okay. How's this volume? Is that better? All right. Thanks, guys. So where this really shines, as far as a tool that you're not used to using, is with chronic conditions. And that's true for a lot of complementary medicine, in my opinion, whether it's herbs or acupuncture. A lot of times it's these cases that have been going on for a long time. We see a lot of cancer patients that other clinics are referring to us because they don't have anything else to do. And we're able to get that immune system back on board and actually go after these cancer cells, and it's making a big difference. We're seeing big changes in these pets. But other chronic diseases, autoimmune, sometimes it's difficult to get dogs off of pred when they've got hemolytic anemia or thrombocytopenia, arthritis, allergies, GI issues, inflammatory bowel disease, and I also use it for critical care stuff. So I was telling people at the booth the other day, we had a dog that came in, 80-pound lab with hemorrhagic gastroenteritis, got him on fluids, Serenia. I mean, I do all my good ER doctor stuff too, right? Did a fecal swab, he has Clostridium, and just pouring projectile bloody poop out of his rear end in the run. I don't remember, maybe 2-3 episodes of this for you. I know my practice manager's back there, Amy, so she's really hands-on with us too, so I'm sure she was involved in the cleanup. And I thought, why don't we put ozone in there? So one of the methods, one of the routes of administration is rectally. And when you give it as an enema, with the gas, it does a couple of things instantly. One is it will kill bacteria, fungi, and viruses on contact. So I'm going to knock out that Clostridium right away. So we did that, and his diarrhea stopped immediately. I did not expect that, but that's just one of those cases where it's just blown my mind again how I can use this. There we go. So this is a definition here. Ozone therapy is a medical treatment that uses activated oxygen, or ozone, to treat many chronic and acute diseases. It reduces chronic inflammation. It destroys pathogens, like I said, and activates the immune system. It can be applied topically, infused into the blood and tissue through various means, or introduced into a fluid or oil which acts as a carrier. So we'll go through the different methods of that, especially in the second lecture. Here's the timeline. So a lot of us have never heard of this, myself included, 2 years ago. But it was actually discovered in 1785. Nikola Tesla patented an ozone generator, which was then used to in water treatment plants to sanitize sewer water. Actually, Las Vegas, Nevada, I found out, cleans all their water with ozone, and they get, I'm sure, some pretty interesting things in their water supply and their wastewater. So they're using it. It's magnitudes of I think at least 10 times more effective than chlorine for sterilizing and neutralizing bacteria, viruses in the wastewater. Then a dentist in 1932 developed an ozone generator that he could use in his dental practice. And actually, one of the ways that on the human side it's being used so much right now is in dentistry. So there's YouTube videos of dentists in Michigan that are using it for implants and gingivitis and tooth sensitivity. It helps reduce that. And they're saving teeth. Root canals sometimes don't need to be done. And veterinarians are using it in the same way also. We use it after every dental, actually. We clean the whole mouth with it. You can inject around the teeth. You can, if you've got a tooth root abscess, you flush the pocket and you're killing the pathogens, reducing inflammation, and it heals much better. So there's a big gap from 1932 to 1970, right? That's about when penicillin came on the scene. So there's no need in general practice at that point. Why go to a doctor and get an ozone treatment if you can just take penicillin, take an antibiotic? And that has helped us for a long time, but now we've swung the other way. And we've got all these drug-resistant infections in ears and on skin. We've got MRSA, we've got Pseudomonas. You know, there are things that we just can't get a handle on if it's in a bladder, if it's in an ear, on the skin, and it's really frustrating. But this is not drug resistant. So it's coming back around. And Russia, Cuba, Brazil, all throughout Europe. Germany is a big proponent of ozone therapy. So we're catching up in the US, which seems to be the case oftentimes with some of these newer therapies. But just so you know, there's a wide use on the human side that is very, very well documented. And at the ozone booth, Jonathan has full notebooks in every category you could think of, whether it's cancer or dental, with publications, scientific publications that prove the validity and the scope of how you can use ozone. So here's one of the things that get people stuck, though. Ozone is a free radical. Ozone is something people talk about in smog, right? So it sounds terrifying. Why would you ever want to put anything like that in your body? But the thing about the smog issue is that before the 1950s, when we really had a lot of car emissions and things like that, there was no worry about ozone smog. So fossil fuels, wildfires, that would be a natural release of it, but cars, industrial smokestacks, that kind of thing, if you get a lot of that in a concentrated area with enough UV light, so there's got to be a lot of sunshine and stagnant air, so I'm thinking Los Angeles, you know, for a lot of that thing. That generates this cycle where the sunlight reacts with the pollutants, and then ozone comes from the stratosphere, mixes with that, and it's going to be in higher concentration because of the pollution. The ozone doesn't cause the pollution, it shows up because of it. So just highlighting that, the UV creates the nitric oxide, and then the O1 connects with O2 to make O3, and that's very dangerous to breathe. When it's in high enough levels, it can definitely, you know, kill people, plants, animals. It's no joke. But ozone itself is an energized form of oxygen. And when it is made in an ozone generator, it's kind of like lightning in a box. So when there's a thunderstorm, the huge charge from a lightning bolt in oxygen will convert some of that O2 to O3. And that's what smells so good after a rainstorm. And the same thing is happening in the ozone generator box. You're taking medical grade oxygen, which is important. You don't want to use room air or an O2 generator because you're pulling air from this space, right? And this is not clean air. It's got pollutants in it. So it's really important that when you're using it medically that it's used with an O2 tank. You can use industrial oxygen tanks, but it's still not recommended because it's not verified that it's actually pure. So it's important if you're going to use it in a pet medically that you're using the right kind. So when it converts to the O3, you've got one extra electron, and it doesn't want to stay as O3. So as soon as you give it into a body, it breaks apart back into oxygen, and then you've got this free radical. It does that action of sterilizing comes when it's still in the O3 portion. Once it converts to O2, you're not killing anything. Oxygen doesn't kill anything. It's important for our tissues, but it's not going to have that benefit. It's very reactive. I believe the studies have shown like it's 3 to 5 seconds that it's actually active in the bloodstream before it breaks apart and goes back into oxygen. Okay. These cycles are just showing some of the pathology that goes on inside our bodies and inside dogs' bodies that will contribute to chronic disease. So Lyme disease, we've got a lot of fat dogs. We've got a lot of dogs that have GI upset and dysbiosis. That's why we're using Fortiflora and Probios and all of these probiotics. Some of our dogs' diets are not great. We all know that. We're always talking to people about their food. Stress, COVID puppies. I've got one that's in my slideshow next month, or next course. Poor sleep. So many of these things are putting stress on us and stress on our animals. And that is creating extra need for some of these alternative therapies and ozone in particular that I'm talking about today. One of the other things I wanted to stress, though, is that because people are not familiar with ozone, a lot of people won't entertain it. Your clients will be, like, why? What is that about? And I myself, like I said, was raised very conservatively as a veterinarian, as a young doctor. So one thing that stood out to me as I was starting to think about talking to you guys about this is how many therapies do we use now that have been previously thought of as sham, or quackery. So I have a list of some of the ones that I have been involved with. So acupuncture, when I graduated in California in the early 90s, there were letters to the editor in JAVMA to have veterinarians' licenses revoked if you practiced acupuncture. How many in here have had acupuncture for themselves? Okay, you get a book. You're welcome. And so we know that people are using it in most of our referral centers now have an acupuncturist on staff, right? Blue Pearl, OVRS. So it's a legitimate treatment option, but it was vilified not that long ago, 30 years ago. Chiropractors, does anybody know what they had to endure? And put in jail. The American Medical Association had a quackery committee that was finally disbanded by a judge, and I think in the 70s, or maybe 62. But anyway, they went for like 20 years getting chiropractors put out of business because they didn't believe that it was an effective therapy, and maybe competition. I don't know. I do think it's important to protect our patients and the public from people who are offering things that probably are dangerous or quackery. But if you've got a good outcome, I don't think it needs to get shut down, and that's where I'm at with the ozone too. So what about glucosamine, adequate injections? Janine, you probably, what do people say?
Really, is that going to work? Just a little injection?
Yeah. But even oral, right? Even oral glucosamine was poo-pooed. I'm old enough to know this stuff. Maybe you guys don't. But actually, it was something that people debated. Most veterinarians did not embrace it for the longest time. Like, they wanted proof. And finally, everybody's got it, right? All right, Janine, that was good. I give you one. There you go. Who's using laser therapy? Oh, wow. Awesome. Okay, I don't know if I have enough books for that. I'll give you guys one. You can share it.
Wow. Thank you.
Also poo-pooed for the longest time when that came out. What's that? You are? All of you guys?
No, we are, the three of us.
The three of you? Okay. Well, you said that you had been to a chiropractor, right? Or you knew that chiropractors had been in trouble, yeah. So it's really the same thing with ozone. If dentists are using it, if anti-aging clinics in the U.S. are using it, athletes are using it for muscle repair and just to recover. Endurance horse riders are using it for their horses after competitions or even before. In fact, it may end up being that it becomes I don't know the term for it, but not doping, but it may be something where you're not allowed to use ozone before a competition because it helps you so much. It's increasing oxygenation and reducing inflammation. Those are like probably the two key things that make it beneficial in that scenario. All right. So how does it work? How is it working? I am not a scientist, but I am going to try and break this down in like the most general terms that I can for you guys that make sense to me. And when we've got a healthy cell, it knows what's going on around it. It's reading the fluids, the hormones, the enzymes that it's bathed in, right? So it's picking up all the signals. There's good communication in a healthy body or a healthy animal. And so when you get a little stress, if you think about even exercise is a stress on the body, right? But we know it's good for us. Maybe we feel like crap the next day and maybe our quads are killing us, but all of that is transformed after repair to a stronger muscle, right? So that's basically what's happening here. When we have unhealthy cells that are getting block signals because of toxins, because of chronic disease, whatever that is, then there's not an opportunity for that cell to compensate. And so it breaks down and we see these we see the IBD, we see the allergies, and cancer ultimately is the biggest one. So the ozone acts as a signaling device. So, all right, bear with me here. I'm going to try and draw a picture of it. This is how my brain thinks of it. So if this is traffic control, ozone is signaling. If ozone is the signaling gas, it's telling NK cells, natural killer cells, to actually activate and make interleukin and interferon, and it's creating peroxide. This is its killing power. That's its superpower when it comes to killing pathogens. When it's introduced into the body, it turns into hydrogen peroxide and also lipid peroxidase, and that will kill the pathogens on contact. Our bodies, actually, the mitochondria, make a little bit of O3 and peroxide on their own. So it's something the body is doing internally already, but sometimes at deficient levels. What else does it signal? There's a whole cascade of trying to remember some of the other ones. Sorry, guys. It will trigger tissue repair because of the oxygen content that gets into the tissues. So one way that I explain this to clients, most people have heard of hyperbaric chambers, right? Has anybody experienced one? Anybody been in one? Well, I did, because I lost my sense of smell during COVID, and I tried. The Oxford Center over by Brighton has hyperbaric chambers that you can, get the therapy in. I could not get to full pressure because my sinuses will not equilibrate. That's why I cannot scuba dive. So that is a therapy that people are using for animals too, but a human has to be in that chamber with them, and if the pet can't tolerate the high pressure in their sinuses either, like me, you wouldn't know that they're in pain having that done. But the whole point of using hyperbaric oxygen is to concentrate oxygen into the tissues to help with inflammation and speed up repair. Ozone does that without having to be under pressure, and you get the stimulation of the immune cells, you get activation of the immune system, and oxygen cannot do that. Oxygen is not a signaling gas like O3 is. There's a lot more information about this in the book that will tell you more about how the mechanism works. Do I need to start this again? There we go. So again, it's using redox signaling or triggering the antioxidants in the bloodstream, because a healthy cell has a normal ability to make antioxidants, and that's what gets triggered. The stress, the slight stress from the ozone gets the healthy cell to start making more of its own antioxidant, and then it can actually do its own repair work. Some veterinarians and some physicians are calling this a pro-drug because it activates so many other pathways that the body normally uses for its own healing. And that's something that acupuncture, herbs, I can't think of one modality that can actually trigger repair on a systemic level like that, because it actually promotes the healing within the cell itself. It tells the cell to do it itself. So here we go. Antioxidant upregulation, just like I was trying to describe with exercise, you get this bit of oxidative stress, but then that triggers the cell to start making antioxidants and repair itself. You get the immune system regulation, the hydrogen peroxide killing pathogens, and improved blood flow and oxygen uptake. And one of the ways that this is amazing in clinical practice is like the dog with HGE that I was telling you about. Because it's creating anti-inflammatories and supplying oxygen, it's reducing inflammation. So that dog with HGE stopped bleeding and stopped pooping immediately. I've used it on cats that have been blocked. Usually when I unblock a cat and I connect them to a collection bag, right? It's pure blood coming out of that. When I ozone that bladder with ozonated saline, it's the tiniest stripe of blood in the collection. And I wasn't even expecting that. We were shocked when we saw that. I was taking pictures because I couldn't believe it. I use it after cystotomies. We have one client who has had a schnauzer, and 3 times I did his last surgery. He had had surgeries other times before me. So when I did his surgery, I lavaged his bladder with ozonated saline. And he called me back 3 days later and he said, "Doc, this is the best surgery she's ever had. She had no blood." Because usually I tell them when they go home, okay, expect some clots. We just cut through this really inflamed, unhappy bladder. None of that. So it's clients notice it right away too in a lot of these cases. It's really fun. So contraindications would be if you have a dog in DIC, definitely don't use that. Bleeding organs, so an active. There are veterinarians on the holistic side that have been doing this longer than me that have actually taken blood from a ruptured abdomen, hemangiosarcoma, and ozonated it and given it back, and they have done well. So there are people that are using it in even more serious conditions than I'm aware of. But as a general rule, you don't want to use that. Thrombocytopenia, again, like I said, DIC, don't use it there. The other contraindication is it's never to be inhaled directly. Our respiratory lining does not, those cells do not make antioxidants like the rest of our bodies do, so they're much more prone to spasm and inflammation. So if you accidentally get a whiff of it, you will be coughing. And we have one staff member who has asthma, and we don't let her anywhere around where the generator is because that would just trigger more of a spasm. Yeah? Absolutely. So I lavage any surgery that I'm doing like that, or if it's a foreign body. My dog Frank ate a Kong toy, the indestructible Kong, while I was at the Midwest Veterinary Conference in February. So I got to drive back on Saturday night and take that Kong out. And, oftentimes if it's been sitting there, if it's at a terrible place, you will get loss of mobility, right, of motility, and the gut color doesn't look good. So I pressure tested her after I made my incision. I pressure tested her with ozonated saline, and the pink came back like that. The gut perfusion was instant. And she started, and you could see the peristalsis coming back right away too. And I lavaged her abdomen with it because, as careful as we can be, I take the bowel out, I put lap sponges around it, I wash it with ozonated saline, but I lavaged her abdomen with ozonated saline too. And I put ozonated saline in her incision, in her linea, sub-Q. They are finding in Brazil that it's better pain relief post-op to use ozone than carprofen. So I tried that with Frank, and I stayed up with her I laid next to her all night with buprenorphine and carprofen ready to give her, and she was fine. It was crazy. And she was eating by the next day, less than 24 hours later. So, there again, yeah. The inflammation of the lung lining. Herxheimer, I wouldn't call it a contraindication or a terrible side effect, but it is, like I said with Chaz, it can look pretty dire. One thing that we have noticed in our practice, if we are using ozone with old skinny cats, they were getting very fatigued within seconds of giving like a rectal ozone, because it goes systemically so quickly, and I'll talk about that in a second too, of that mode of action. But they can become hypoglycemic. I don't understand the mechanism of action for that, you guys, but Dr. Roman, who's been doing this for I think over 20 years, has noticed that has happened in her patients. So we put honey on their gingiva right before we do it, and we've never had a problem since. But we had 3 kitties in a row that were like, oh, what's going on? So that may be in that same category of Herxheimer, but we have been able to avoid it by using gingival honey. So this is Auggie. Augie's a 2-year-old neutered male. Bernese Mountain Dog. He was seen by his regular veterinarian for chronic nasal discharge, and he was losing pigment by his nose. Dang it, I shouldn't have put that up there. I would have asked another question. What about that says nasal aspergillosis to anybody? How do you know it's a fungal infection by what I said? Anybody? It's the loss of pigment at his nose. That's pathognomonic for aspergillus. So if you see that, if you see snot and they're losing pigment, that's aspergillus. When we saw him, he was like the Walking Dead. He was so sad. I mean, you can see his little face here. It's so sad. He had lost 15 pounds. They could not get him to eat anything, hardly anything. I think they were down to hamburgers from Wendy's or something like that. Extremely lethargic. Like it took him forever to get up off the ground and to try and come down the hallway at the clinic. On the conventional side, the treatment of choice is to surgically open that sinus cavity and curette all of that colony out that you can. Of course, that's not going to be 100%. He's a big guy. They were using a new antifungal medication that's $1,000 a month for a dog that size. So the bill was going to be about 10 grand for the first 6 months. And they didn't have money for that. And the prognosis was not curative. You can scrape the colony, but you're not sterilizing that area. So there's still going to be fungal spores, and so he was going to have to be on this antifungal for 8 months at least. So they were referred to us, and we started treatment with him. This is the CT scan that came from the specialist. And let me see if I can get this to play for you.
Hey guys, so I'm just looking at this, and I'll send it.
I don't think you can hear it.
But, this is healthy side, okay? And we're
showing the healthy side on the right.
And so you look at this. Like,
that's the sagittal section.
Like that's the cross section that we're looking at with the red. So this is normal.
So they're going to start scanning back from his nose to his brain.
Roll every millimeter. You just see that there's this whole dense area in the nose that's affected, and it goes like all the way back to like this sinus. You know, it's all the way back in this congested sinus. You can see that this is open and normal, and then this has this fluid-filled area. If I bring this one over, so then you're looking at this, you can see
that really shows it.
Abnormal, you know, and some of the changes that are happening in the disease side.
So pretty grim. I read that CT when they sent that over, and I thought, oh my God, I had never seen one like that. Yeah.
I'm so sorry to interrupt. I'm a veterinary nurse, so I don't have medical knowledge. What side was the bad side, the fungal?
Oh, it's all this congestion, all of that. So all of the white part that's taking. We want air in the sinuses normally. So the black is what you want to see. And when you see something occupying space like that in a sinus cavity or a nose, it's usually cancer or it's fungal. In his case, thankfully, it was fungal. But he was so sick, and it's so progressed to this stage that I didn't know how to treat this. So I reached out to Dr. Roman and Dr. Rubin. They're two veterinarians that have been doing this for quite a while. And I said, what am I going to do with this guy? And they gave me a treatment protocol that they would try. So we hospitalized him, put an IV catheter in, and we drew some of his blood, mixed it with ozone and saline to activate the immune system and also to kill any circulating fungus, and gave that back as an infusion. So we give it over like 10 minutes, 5-10 minutes, slow. And you can use it through, with little animals, you can use just a butterfly catheter. But we were doing larger volume with him, like 20-30 mLs, plus the saline. So we used an IV catheter. Plus, we were going to treat him every single day, 3 days in a row. That's really rare. Usually you're treating once or twice a week, not like this, but he was so sick. By the 3rd day, we also used a nebulizer. Remember I told you you cannot give ozone directly to the respiratory tract? If you bubble it through olive oil, it changes the ozone to something called an ozonide, and it's safe to breathe. So he got nebulized. There he is sitting in Antoinette's lap. We're just using a surgical cone, a mask, anesthetic mask, piped directly from the ozone generator. And he's laying there on her lap getting his ozone treatment. So we would nebulize him for 20, 30 minutes. And we did that every day. So that's getting it right where we need it, right? We've got his mouth closed, so he's getting it into his sinus cavity. And we gave it rectally. So I'm going to stop there for a second and explain why that works. Because it makes sense, right? If you ozonate saline and you can give it IV, that makes sense. It's going systemically. So this is a butthole. And that's a liver. So there's a huge blood supply that comes from the colon that goes directly to the hepatic portal vein. And, okay, here's a fun way to earn books. Tell me some things you can put in butts that get absorbed systemically. Drugs. You already got one. Capstar, yes. What did you say? Yes, yeah. You can do lactulose. Okay, what other seizure medicine? She said Valium. What else?
I can never say that.
Keppra?
Yes, that.
Yeah, you could. Phenobarb. Phenobarb is, before we knew we could put it up noses and get it absorbed. There's also, does anybody know what Unum-Biao is?
Yeah. What?
Unum-Biao? Yes? How do you use it? How do you use it? Yeah. The next time you're a doctor, or if you are a doctor, you have hemorrhage and surgery, open those capsules, mix it with 6 cc's of water, and stick it in the butt. Right? Because you're getting it systemically because they can't swallow it.
Thank you.
Yeah. Yeah. All right. So that's why when you put ozone, when you put it right here, there are little silicone catheters that we use when we're giving rectal ozone. When you put it just inside this part, like on a kitty maybe an inch or 2 in, with a dog maybe 3 inches in, you're hitting this blood supply right here. So it's getting access to the bloodstream almost instantly. So that is how we got it also into Auggie's bloodstream. Okay? And I've got 5 minutes left, so we'll get through this. That's Auggie a month later. He gained all his weight back. He was barking at the UPS guy. He was eating his regular food. He did great. He did great. So, any questions so far? Yes?
This isn't as much the medical side, but this is also completely new to me, so how I'm imagining it's somewhat expensive.
Okay.
Like how much do you tend to keep in stock? Like how, if we wanted to try it?
Yeah.
How
So
does it come in a certain quantity?
Dr. Lucas, can you repeat the question?
yeah. So she's asking, how do you keep this in supply? How do you get the oxygen? how do you get the ozone? It actually has to be generated because it's so quick to break down. You have to make it on the spot when you want to use it. So there's an ozone generator. If you get a chance to stop by the O3 booth, there's actually a unit there that shows you how you can bubble it through a big saline container. We use it. Well, I'm going to talk about that in the next session, but. Yeah, you have to have an ozone generator because it's so reactive. It breaks down into oxygen too quickly. You have to make it on the spot. But to your question about how expensive is it, we had to really prove the bottom line that we were going to buy this machine and put it in our practice, and we got the big guy. So the regular size unit is, well, Jonathan can tell you for sure, but I think it's 4,000 or something like that. We got the big enchilada, which is how you can do these IV blood treatments, and that was 12,000. We made it back in 2.5 months. Yeah, and that was in January and February, guys, of this year when it was bleh. Most practices are slowing down that time of year, but it still recouped right away. Because we can use it for so many things, because it turns on the body's own innate abilities to heal, and you can kill pathogens. It does both of those things. All right. I think yes.
I have a whole list.
Okay.
Sorry.
All right.
Are there any systemic medications that are contraindicated with the use of ozone?
So she's asking, are there any systemic antibiotics that are contraindicated, or probably
Just medications.
Medications in general.
Systemic things in general.
All right.
Oh, I have. You gave me one.
I should probably save this for the next few lectures anyway. No, it doesn't interact with any medications at all. No.
My next question is, can it be used, because I like the idea of the saline, can it be used to flush out an open wound that involves bone or joint spaces?
Absolutely.
Ooh.
Absolutely it can. So so she's asking, can you use it to flush out joint spaces or open wounds? Because it's delivering oxygen and killing pathogens, it's the ideal thing for that, actually. So because you're a horsey person,
That's exactly
one of our vet techs has a horse that is in pasture with an asshole, and he kicked her horse on the rump.
Okay.
So when cats get bit across their dorsal midline, what happens? You be quiet. You already have a book. Yeah, it puddles, right? Because you don't have gravity to drain that off. That was the same problem that she had with Champ, is that this was high up on not the wither, the what?
Are you talking about the butt?
Yeah, the butt, I guess. Okay. And her vet came out, lanced it, flushed it, and it was starting to puddle down his leg. It was getting almost to his stifle. And she's like, Doc, I don't know what I'm going to do. So before we had our big chimp machine that you'll see, I have a little portable guy that I started when I was doing relief work and to keep at home for my dog Chaz and other pets of mine. So I told her to take that with her, and she made her own ozone saline in the paddock, in the field, and flushed it. And she did that for 3 days. And by the second day, actually, all the swelling was gone. Yeah. All right, that's all the time we have.
Okay.
Please bring more questions to the next session. The next one is going to be really fun, you guys, because it's case studies. All right?
Back in about 10 minutes.
All right. Thank you.